Hi guys, on Sunday James Not So Cleverly was interviewed on a number of media outlets. He tried to claim that increasing nurses' pay in order to avoid strike action had nothing to do with the government. That the Tories have resorted to washing their hands of the situation, saying that it is either an issue to be sorted out between the NHS and staff or babbling on about an independent pay body. However, this position was destroyed by the head of the Royal College of Nursing, Pat Cullen, when she appeared on the Laura Kuenssberg show. Have a listen.
As soon as the Health Secretary gets into a room with me, whether that's through conciliation or on a one-to-one, I'll certainly not be found wanting in my negotiations.
So you would give some ground on that original demand?
I'm not saying I wouldn't. And I certainly, as I said during the week, I won't dig in if he doesn't dig in.
OK, so you're indicating some flexibility there?
Well, look what happened in Scotland when the First Minister asked to meet with me. And it was on a Friday, and by Friday evening we had suspended our strike dates for Scotland. So that's, again, very much demonstrating we aren't for digging in. That's not what nurses do, and I'm a nurse. So come on, let's have the discussions and let's have the negotiation.
But in Scotland, though, there was a less generous offer from the government than your original demand. I just want to be really clear on this from our viewers. You're saying this morning you would accept less than you've been asking for so far in order to be able to pause these strikes.
No, what I've said is come to the table and let's have the discussion.
Now, there's a few things to say about this. First of all, Laura Kuenssberg, does she not understand how negotiations work? It's obvious that the nurses in Scotland went into the negotiations with the Scottish government demanding more than what they finally accepted. That's normally how negotiations work. You aim high and you compromise your way down to something that's acceptable. The same would be the case if they were able to negotiate with the Secretary of State in London, in Westminster. But the problem is the Secretary of State doesn't want to meet with the nurses to talk about pay. We'll talk about other things, but we'll not talk about pay. Why? And we're back to the main point once again. It's ideological. It's about driving a wedge between the public and the nurses here, trying to paint them as people who are greedy, people who always want more, who should be thinking about others during this cost of living crisis. Trying to convince, and with the media of course, trying to convince the public to turn against the nurses. That's what it's all about. It's disgusting. You know, you had Boris Johnson, you had Rishi Sunak, you had others clapping for carers, clapping for the NHS 2 years ago. And now when the NHS workers come, the nurses here ask for, to get some money back. They've had their pay frozen for a period. They haven't had increases to match with inflation. Nurses are relying on food banks. Food banks. How is that acceptable to anyone in the government? So they're asking for the money to bring them up to the level of inflation. Will they get that? Probably not. But they have to aim high in order to compromise to something that's acceptable. And, is below inflation acceptable? It shouldn't be, but they're hoping to get something as opposed to something crappy like 3%. But it needs the Secretary of State to come and meet with them and talk about pay. And instead, all you're hearing is, well, there's the independent pay body, which agreed 3% earlier in the year, or that this has nothing to do with the UK government, it's between the nurses and the NHS. Who is ultimately responsible? Who is the employer here? It's the UK government, because the NHS, for now, is public. So it's the government can decide this, as they did in Scotland. Scotland is separate from England and Wales. So it is the responsibility of the Secretary of State for Health to sit down with the nurses and agree a pay increase that's acceptable to them, to bring them off this strike action. Otherwise, there's going to be more and more suffering. Let me know in the comment section, guys, what you think about all of this. As always, your comments are greatly appreciated. Thanks a lot.